with that, I am going to introduce our speaker for today. Heather Grable is a project coordinator for the Indiana Rural Workforce Innovation Network, or IRWIN, for the Indiana Rural Health Association. She obtained her AAS in respiratory therapy from Ivy Tech Community College and then went on to achieve her BS in healthcare management from Franklin University and MS in management with an emphasis on organizational behavior and leadership with Indiana Wesleyan. Is that how you say that, Heather? University.
Yes. Yes.
Heather's been in higher education since 2004 and online education since 2008. She's experienced in curriculum development for a variety of course topics as a subject matter expert, specifically allied healthcare related courses. She's worked for Ivy Tech Community College and Minnesota School of Business doing curriculum development for both, and also teaches adjunct at Indiana Tech. In addition, she has experience in pulmonary rehabilitation, quality improvements, performance management, as well as serving as the accreditation counselor for healthcare organizations. Heather was raised in a small town in Indiana and is now raising her two sons in that same small town with her high school sweetheart. So I am going to turn it over to Heather, and she is going to walk us through their rural health course. And we're going to be watching a video and also going to be going to their website. So we'll be able to do a little toggling back and forth between the Adobe screen and my sharing my screen for you all to be able to see the YouTube video and the website Heather wants to show you. So with that, thank you so much, Heather, and I'm going to turn it over to you.
Okay, thank you. Well, hi everyone. Thank you for attending today. Like Angie said, my name's Heather, and I'm a project coordinator for the IRHA, specifically under IRWIN. And IRWIN is the Indiana Rural Workforce Innovation Network. And when creating IRWIN, we decided to take an educational focus to strengthen the rural workforce in Indiana. Our initiative was to support this effort through strategic hiring and a retention plan, and to create a rural health course curriculum as an elective through one of our grant partners. Now, as many of us know that are working in rural health, there's so much to know about rural and how different it can be from the urban healthcare setting. And so we also know that even when working in urban areas, there's still a huge rural impact on those urban and metropolitan healthcare facilities because of disparities and social determinants of health. So any student in any health track from clinical to management would benefit from taking this course. The partner that we initially had also wanted to include a clinical rotation program into that rural health course, which would physically place students into the rural workforce and introduce them to institutions like critical access hospitals. So like clinical rotations do, it would also help those students to make connections in the rural facilities and in turn those facilities would be introduced to future employees. So really quickly, when IRWIN was established, we knew we wanted our mission and our vision statements to directly reflect our passion for this initiative. As you can see on your screen, our mission was to become a sustainable, rural-focused workforce network that recruits motivated students, delivers allied health professions, education, and training, and facilitates meaningful clinical experiences and places graduates in rural allied health profession jobs. It was important to us to give students the opportunity to learn more about rural health and how it really impacts all of us, whether directly or indirectly, and to also become sustainable so that post-grant funding we could continue on with our efforts and this vision that we saw that was so necessary. Our vision was to provide rural employers with access to allied health profession students with the skills and experience and education necessary to catalyze a high-quality, safe, and cost-efficient 21st century rural healthcare environment. What does that mean? To us, it means that we are serving our partners and our members in a way that hasn't really been done before. And we had no idea the life that this would actually take on. And as I go through the slides and go through the presentation, you'll see what I mean by that. The goals and strategies, and I'm just going to click through these. The goals and strategies of Irwin were a reflection of our mission and vision that I just shared with you. We wanted to create and establish a model of training for allied health students with that focus on rural. And then we wanted to take this model and make it replicable and sustainable to further push the message out to students, and then hence benefit the rural hospitals we've partnered with through the INSERN network and beyond. And just a little history about INSERN. INSERN is the Indiana statewide rural health network, and it's a mature network of critical access hospitals and rural healthcare clinics. And it was developed by a previous grant that is now sustainable on its own. Our initial goal at this phase was to create this with the help of our state's community college system. Another goal that we had was to encourage those allied health students to seek out and learn more about and to explore the opportunities that lie in a rural healthcare setting, and to train those students within our rural health partners in the culture and the climate of rural health. And our education partner also seeks to include that clinical rotation piece in the INSERN network and to deliver hands-on training. In addition, and ultimately, both our goals and our strategies were to seek and secure employment for these students in the rural settings. As Angie mentioned, I am actually a respiratory therapist at heart, and as a student going through my own clinical rotations, I was being recruited during my clinical rotations at various sites, but especially in rural hospitals, because honestly, we didn't go to many during our clinical rotations, so they didn't get to see as many students as what those larger hospitals saw. As a respiratory therapist, our main focus in our second and third year of school was the ICUs, the NICUs, and the PICUs, and those special units. In those large hospitals with 30-bed ICUs, where we could learn about ventilators and all of those that it entails. So when I first got into higher education, I was director of clinical education for a respiratory care program, and I made sure that my first-year students were rotating through at least 2 rural healthcare facilities in their first year, because I saw the value of them learning this side of respiratory as well as the fast-paced level 1 trauma centers. Both are important for us all as clinicians to see and understand. And I was pleased when I signed on with the IRHA to see that this was also a passion that they were also trying to receive. And also as a student, in my first year of general education credits, there really were no electives that were available to me that would benefit my future career other than medical terminology, which later became a program requirement anyway. So I ended up taking an advanced microbiology class, and it was a great class, but I would have loved to have the opportunity as a student to take a class like what we have developed, this rural health course, to kind of fill that need. As an educator for more than a decade and a clinician for almost 15 years, I see value in teaching students about rural health care and how it affects population health, and then directly whether or not they work in a rural setting or the biggest hospital in the biggest city. And so we developed a 16-week course curriculum that included both a didactic and a clinical portion that focused solely on all things rural to introduce the students and prepare them for dealing with patients directly in this setting, or even when those rural folks come to the bigger hospitals. It was important that they understand those disparities and those social determinants of health and mental health in a rural setting, and so on and so forth. And so this class was born. When I started with the IRHA, I actually, Cindy Large can attest to this, I had to request a cheat sheet for all of the acronyms that were being thrown out there in general conversations. And in meetings, I often would have a deer in the headlight look and would lean over to whoever was sitting beside me and say, what does that mean? And it was appropriately our first module of our course that we've created is the ABCs of Rural Health. And it really drills down and focuses on the most commonly used acronyms specific to rural. As you can see on your screen, we've got the RHI, HRSA, FQHC, the CAUSE, the ACOs, the CHIP, the MACRA, CMS, 4, if I could go on. And that's just the tip of the iceberg. So we felt so strongly about the importance of communicating these because they're mentioned and they're referenced and they're highlighted throughout the course, especially because students were asked to do a community health needs assessment, or a CHINA, which there's another acronym. And we realized it was almost like a different language, much like anyone that has worked in a clinical setting can attest to. So many of the clinical sites the students will eventually rotate through or could potentially be employed through will also be using these acronyms. And we know that some are used to describe organizations, some are used to describe agencies to support rural health in the nation or perhaps in your individual states, and others are used to describe geographic locations or shortage areas in certain regions. So we really thought it was best to start this rural health class with a basic introduction of these acronyms so the learners would be exposed to throughout the course. So on this slide, this represents the different topics that we cover in each module of the course. For example, Module 2 is all about what is rural. And as we found in our research, many of our learners and even health professionals don't always have an understanding of exactly what rural means. So we take the opportunity in Module 2 to introduce them to the definition of rural and help them identify a community, perhaps it's their own that they live in, that is categorized as rural. And this is the beginning of their community health needs assessment that they work on throughout the course. And as you can see on the screen, we cover a variety of important topics excuse me, that are specific to rural. So from rural health disparities to agribusiness, mental health and substance abuse to wellness and telehealth, many critical and important issues and topics are covered in depth. We feel that each module is a piece to a very important puzzle of not only defining rural, but understanding rural health and the people living in those areas and people working to serve in that healthcare sector. So the course we've developed does not just benefit the clinician, but anyone involved in any walk of healthcare, whether or not they're specific to rural. So this is a video that was created by another project coordinator at the IRHA. Her name's Allie Orwig, and we interviewed past students that had successfully completed the course, as well as our executive director, Dawn Kelso, at the IRHA. So this will give you a little more insight into the student perceptions of what the course was all about. And I will say before Angie flips over that all of the pictures you see were taken in Indiana around our critical access hospitals and our rural health clinics. So we didn't just go online and pull random pictures of rural settings, but we actually went out, boots to the ground, and went out and took pictures to make for this video. So Angie, whenever you're ready.
All right. And can you see the video?
I can see it.
All right. When I heard rural health, it made me think of my home. Okay. Try that again.
Full agenda today, and the meeting today was extended for an hour and a half.
I think you went to the next video. I think you need to go back.
All right.
Presentation with some updates and all calls.
There you go.
When I heard rural health, it made me think of my hometown. I am from Vermilion County, so that's considered a rural area in Indiana. I love growing up in my small town, so bringing that back, everything that I've learned, there's not a lot of ultrasound technicians or sonographers in the area. So for me, that would be easy to get a job, and it would be, very valuable to the community to provide a service like that. I didn't really know that I'm learning now is really intriguing, and it's really fascinating to see what is going on in the community and how it's doing overall. Coming into the class, I didn't realize the barriers of healthcare that the rural residents face. There's a lot of citizens who don't have the transportation needs, and if there's something specifically wrong with them, they can't get that taken care of in the area. They can't get certain testing done just from the lack of physicians, the lack of facilities that are just not in a hospital, that need to be in a clinic or need to be more widespread. So there's a lot of barriers to providing needs for specific health problems. I've learned where to find information on the community, and wanting to work in rural health, it just creates a better understanding of citizens that come from that area. Even not working in a rural or critical access hospital, you're going to get those residents as well, because a lot of them have to come to the urban area because of the lack of facilities again. So they have to come to you anyway, and it gives a better understanding. It's a really good class, because if you're into doing research and taking the time to look at the information, you can learn so much. And if rural health is something that you're interested in, go for it, because by taking this class, you're opening up more opportunities for yourself in the future.
Some of the most obvious things that I think people enjoy when they think about rural is just the being out in nature and the beauty of it. Maybe it's a slower pace, but for me, what I've experienced my whole life is I have grown up and have always lived in a rural setting, and now working for a rural health organization that I value the most is when rural folks come together for either pleasure or just a joyous time, or most often it's whenever there's a situation or a problem that they're faced with, and it's just amazing how they come together. That's the part I enjoy the most.
So she's going to switch it back now to my PowerPoint. And the screen you're going to see as soon as it loads is some of the student feedback that we got. We had them do a survey. So just give me just a second while this loads so I can see what you're seeing. Nice siren in the background. That's not part of the presentation, by the way. I'm going to go ahead and keep talking while the presentation is loading. But we really had nothing but positive feedback from our students that completed the course. Part of their curriculum, like I said, was to complete a survey. So we were able to gather feedback from that, including the ones that you're going to see on your screen. One student said she was ignorant to most of the real issues facing rural healthcare and didn't know any measures being taken to aid patients and healthcare providers with those problems. Another stated that getting to learn more about rural health was an eye-opener to the options that she had in her career. And really this one hit home because that was a big part of our vision and our mission, if you recall, and our goals from day one. Introducing students to the rural setting to show them other options in their career beyond that busy, bustling metropolitan and urban hospital, putting healthcare workers in the rural setting and keeping them there, that really gets to the heart of the issue. Another student talked about how much they learned in rural healthcare and the challenges that went into making it work to better the community. And to me, when I read that, I think it sounds like the student really learned not only about rural healthcare, but also about population health and public health. And that's a valuable lesson that she will take with her, or him, actually I don't know if that's a boy or a girl, throughout their career as a clinician and future as maybe a manager or a leader. So as you can see, I'm just going to throw these up there while I talk about them. Our top success was the actual development of the curriculum. It is quite robust, and what we're proud of about this curriculum is that it can be ramped up to fit a graduate level, or it can be taken down a bit to fit more of a high school classroom setting. As it stands now, it's an undergraduate, around a 200, 300 level course. It could also fit a 100 level. It just depends on the varying standards of academic rigor of a particular college or university. And we also had quite a bit of positive student feedback, as we just went over in that last slide. In the pilot program, that included a clinical piece. We were able to place the participating students into the rural setting, and almost all of them were offered positions upon graduation. And as a former student myself, that's one big worry that kind of hangs over your head is, where will I work and will I be able to find a job? And where these students were placed and offered employment was also in their own community or near enough that it was conducive to their family and their lifestyle. We also started to formulate the idea of offering this course beyond the college or university and to healthcare professionals or administrators or leaders in rural health. And our vision was to create modules full of useful information about rural health and leadership in rural healthcare. And so with that, we saw the need to start looking around for a learning management system, or an LMS, as I will refer to it several times throughout the rest of this presentation, which led to the development of our own LMS through Relias Learning. So through our LMS, we're also able to offer various opportunities to our partners and to third parties, as well as continuing education for a variety of healthcare professionals and administrators and CMEs, which I will also discuss in just a couple of minutes. First, though, let's talk about some of the barriers and the solutions that we came up with throughout this process. Our first barrier I'm going to talk about is the community college program requirements. Community college programs are full, and they offer little to no wiggle room as far as curriculum is concerned. And it became quite difficult to enroll the number of students that we were seeking because of this issue. And in my own education, I had, like I said, I had some room for electives in the beginning while I was taking my prerequisites, but once I got into the program, there was no time and there was no room. A second barrier that we came into contact with was financial aid issues, and those arose for a variety of reasons, but still I don't necessarily understand, and that's okay because I'm not in the financial aid world. But we tried to help offset those by offering scholarships to some of those participating students. We also realized quickly that we needed to copyright our intellectual property. Subject matter experts and partners had worked very diligently to create this curriculum, but so here it was on a platform at a community college for anyone to gain access to and review, and in turn take as their own. So we sought legal counsel, and we were able to obtain a copyright about a few months back. So barrier number 4 was preconceived ideas about the curriculum. So many didn't understand what the curriculum was or who it would serve or what topics it would cover. So we worked really hard to start communicating the details of that rural health course and all that it entailed while still upholding the copyright of our intellectual property. And we'll talk a little bit more about that when we talk about our strategic meeting. So some of our solutions to the barriers that we encountered were to target different populations of students. So opening this up to universities and taking it beyond the community college setting. And this is actually in the works right now with a couple of universities to offer as an elective, but there's also, we're in talks with them to build this curriculum into their public health and their healthcare management programs. As we discussed previously, we also saw value in offering the course as modules to professionals through a type of certification, which is also currently in the works as we speak, and to start offering this in different formats, making it maybe 8 weeks or 6 weeks, or adjusting the levels of the academic rigor and creating a more robust curriculum. And we already talked about that we got the copyright on our intellectual property, and also ramping up our marketing efforts and keeping track of a dissemination plan and pushing our services throughout the state and nationally. So this slide's going to talk a little bit about our business plan. And it was apparent that developing a business plan for Irwin was necessary, as well as incorporating our vision for the White Bark Health Academy, which I will discuss in the next slide. But first, we began with a 5-year strategic plan in year 1. And this helped to guide our project and to evaluate our strengths and our weaknesses, as well as identify current and potential opportunities to employ such a project. So this was actually led by the project director, Cindy Large, who's also on the call with us, who had a vast knowledge of grant writing of this caliber, as well as developing a sustainable network. In fact, she was the lead on developing the INSERN network that I talked about previously, which is now one of the most, if not the most robust, strong, and successful network that the IRHA currently has. Very far out of grant funding and is completely sustainable. So in year 2, we started to work on the recruitment and retention plan and set that into motion. And this was not only to recruit students, but also other key partners from other rural-focused associations to universities and colleges and beyond our original community college partner. So Business Plan A, as I called it here on the screen, this is where we took all of this information created at that point and developed a track and a tangible design for Irwin. And it outlined the basic duties and the responsibilities, the market analysis, the strategies that we wanted to use, and the partners identified, as well as our estimated operating costs and revenues. So recently, Cindy and I have returned to the business plan as our project has taken on new life and ventured down new paths that we never could have predicted. And we're now focusing more on new strategies and marketing plans and ways of delivering the rural health course and ways of delivering those continuing education credits that we will discuss in just a moment. We've also identified some new key partners, specifically a prominent university here in Indiana. And in fact, we gave a presentation on Irwin, and maybe some of you saw it, and the rural health course at the NRHA annual conference in San Diego in May, and then at the IRHA annual conference in French Lick, Indiana. And it was in French Lick that that university approached us about the potential for incorporating this rural-based course into their curriculum. And so that spawned that this curriculum needed to be offered completely online. And as well as we needed to develop fee schedules so we could create a rev share plan between the IRHA and the participating university. We're currently in contract negotiations with that university to offer this class within their public health and healthcare management program. And if you would like a copy of the business plan, my information will be on the screen at the end of this presentation, and feel free to send me an email and I can send you a copy of that if you'd like to see what it looks like. So White Bark Health Academy is the Irwin Sustainability Plan. Sorry, I had to take a drink. The White Bark Health Academy is actually under something called White Bark Corporation, and that is the for-profit arm of the IRHA. And a lot of people, when I say White Bark Health Academy, they look at me and say, where did you come up with that name? And I didn't come up with that name, but I can tell you a little bit about the history. About white bark, the quaking aspen is the most widely distributed tree species in North America, and its pristine white bark can be seen for miles. And it provides a unique capability in that the bark layer of these aspen trees carries out photosynthesis, which is usually a task reserved for trees with leaves. But in the winter, when other deciduous trees go to sleep and go dormant, the aspens are able to continue to produce sugar for energy. And so deer, moose, and other wildlife will seek shade from the aspen in the summer, and in the winter they consume the barks and leaves and all of that throughout the year. But what is amazing about white bark is that it's really a large system of millions of trees that's supported by a singular root network. So underground they're all connected, but they have life individually, one tree at a time, and that's kind of how we are at the IRHA and White Bark, that we're all interconnected underneath, but we've got our own projects going on up above. But underneath it all, we're all one big organization. So that's kind of where the name White Bark came from, and White Bark Health Academy. So that's what I was hired to do for this specific task. I began vetting and reviewing potential LMS providers, and Cindy led the initiative to trademark and copyright the White Bark Health Academy with our intellectual property. I went through a rigorous 1-month training to become a super user once we chose to use Relias as our platform. And October 1st, 2017, we launched our website, and it is now up and running. Later in October, I was able to demonstrate White Bark Health Academy and all that it offered to our intern CEOs at a dinner. And we've had a variety of other marketing events, including the November Fall Forum through White Bark Health Academy, as well as the Kentucky Rural Health Association annual conference and several other places. And through this, we expect to gain revenue in 2018, which will lend itself to our end goal of program sustainability. I think, Angie, I'm going to have you skip this slide because I think this is actually in here twice.
Okay.
Yes. Yeah, so we'll go back to that website in just a moment. So the White Bark Health Academy offers over 1,500 courses in a variety of categories. It is cost-effective. It offers those in healthcare field the ability to obtain some of their continuing education and CME credits without having to take time away from work. And when you're in a rural setting, taking additional time off can really put an added strain to the workers that you leave behind, and in turn can put a strain on the patients and then the hospital itself. And in the rural hospital, continuing education credits aren't offered like they are in bigger organizations. So when for an example, I was a respiratory therapist, I worked night shift, and when I would come off of night shift, usually about once a month, there would be some rep there in the department, whether it was for a ventilator or a new piece of equipment that was the latest, greatest BiPAP machine, for example. And they would come and they would offer these little 20, 30-minute demos, and basically you just signed your name to a piece of paper and they gave you a continuing education credit and you were done. But those vendors don't go to the smaller hospitals. They target those large urban hospitals, specifically in Indianapolis where I worked. And so this is great for those in rural healthcare because they can achieve their continuing education without having to drive 2 or 3 hours to do it. And it is very cost effective. I did a demonstration for one of the addiction services managers at one of our critical access hospitals, and when she saw the prices on the courses, she said, well, I wish I'd known about this about 2 months ago because this is half of what I paid. So, and I will show you that in just a second. Some of the possible categories that we have, they're abundant, but we've got, as you can see on your screen, acute care, post-acute care, behavioral health. We do have some CMEs, and those are growing by the month. They're adding more and more of those. But we also go into some administration and leadership classes, HR, health and human services. So we really do offer quite the gamut of courses. And along with those, we're also able to host events and provide links to previous events. So we get to host for recordings like such as this. We can track attendance, we can run reports on our return on investment and participation, and we're able to offer this platform, like I said, to our partners and third parties as we've already incurred the cost through our contact with Relias. Participants can also keep track and record all of their continuing education in one place. Instead, anything that was done outside of White Bark can also be done, can add it to this website. So as a respiratory therapist, we are always run the chance or risk, I guess, of being audited. And if they come to me and say, Heather, we need you to prove that for the last, for this biennium, you achieved your continuing education, well, I have to go to this website to pull them off, this website to pull them off, and I've got to go here and I've got to get this. And White Bark offers you the ability to keep it all stored all in one place. So, and I'll show you that in just a moment. Switch over. Courses are approved for CEs and CMEs. They have specific accreditation specs, and meaning there are, and I don't think that I've actually ever sat down to take the time to count, but I think there's over 120 accreditation bodies that have approved specific courses for contact hours or for continuing education hours. All of the courses are written by subject matter experts or SMEs. They author the courses, they update the courses. You're also able to search by accreditation specifically. So I think now, Angie, if you want to click on that website, and I'll try and guide you through, because Angie and I figured in the beginning that I can't actually be the one to do it, so I'm going to have to kind of walk her through how, but it's pretty user-friendly. That's one of the great things about this website. Okay, so when you first get in, Angie, over there on the right-hand side, do you see the login button? If you could click on that. And you can poke around the website and you can look around, no problem, but if you actually want to start adding things to your cart, you have to create a free account, and you can click on that. Angie, well, you don't have to click on it. I'll just tell you what it says. It just wants it wants you to create a username and password and put in your email. That way, you can always track what's going on. So if you go over here and just hover over My Academy, Angie, it's on the left-hand side, and yep, right there. So you see My Courses. So any courses that you take or load, that's where they will live. If you go down to Transcript, that is where all of your transcripts will be of any courses you've taken on White Bark Health Academy. And if you want to go ahead and click on Add to Transcript, not sure if it'll do it without being logged in. Well, and if it was working, you could see, or if I was sharing my screen, I would log in. But you can see where you can add different, let's say you went to a conference and you have a certification, you can upload that, and now it's all in one place. And I think it's doing this because you're not logged in, so that's okay. We can go right past that. But that's just a great place for you to store everything, and then you can go in and do a PDF, transport it to a PDF file and print it off, and there's everything. So if you hover over continuing ed courses right there in the middle in the gray bar, that's where some of those categories I was telling you about, from acute care, behavioral health. So let's look at an acute care course. So if you click on acute care, so it brings up this screen. And over here on the right-hand side, you can see where you can search courses. So if you wanted to type in something to do with ECGs and you type that in, it would give you the search results would give you everything for anything to do with ECGs in the title. You can go over here on the left-hand side to say narrow your results and click the down arrow, and it will pull up all of the accreditations or the accrediting bodies that have approved certain classes. So if you want to look for the American Nurses Credentialing Center, there's 122 classes just in acute care, and you can see that this is just in acute care. So if you switch over to a different category, these can all change. So you just click out of that box. So if you just click on that very first one, Angie, where it says, does your organization measure up? And so it has this first little, basically a summary paragraph of what this course is all about. And if you scroll down a little bit, underneath that paragraph, you see where it says certificates, and that's where it will tell you how many hours or contact hours or continuing education hours that those have been awarded by specific organizations. Yep, just like that. If you go to reviews, that just gives you a list of the reviews, how many stars someone gave it. And if you go over to details, on the details tab, it's kind of like a mini syllabus in that it tells you the course and how many hours and when it expires. It gives you a learning objective, and then almost all of them, which I did find one today when I was preparing for this, but this one's great. It gives you the instructor and why, like this Linda Lagenza, and that she's a licensed clinical social worker, and it kind of gives you a background of where she comes from. So you can see that these are subject matter experts. And if, yep, exactly. So if you were going to add it to your cart, which you won't be able to do, Angie, because you're not logged in, but if you did add it to your cart, it would come up and you could continue shopping, or you can go to your checkout, and then it would tell you that this course is valid for a year. So if you purchase it, it goes into your My Courses tab that we looked up at the top, and then you can access that course, excuse me, with any time between the next 12 months. And after you complete the course, you can always go back and review the course once it's completed. If you hover over the admin leadership courses, this is any course, just click on administration. That'd be fine. The very first, yep, right there. So you click on that, and then this is more of the administration or leadership courses and compliance and ICD-10 codes and things like that. So there's really something for everyone. And it's the same thing. You can search the courses, you can search by accreditation, and it shows you the cost and the hours and so on and so forth. If you go over here to events, which is in that gray tab, yep, right there, and you click on that. Nothing here right now. Like I said, this is pretty new website, but when we start loading lunch and learns or events that the IRHA is having, this is where you will start to see them. And this is also a place where we can provide our third parties or partners with the space to host a live event, or we could do an event like a webinar, or you could have your event signups here. And if you were going to record it like we're doing today, and then we wanted to go back under the Whitebart Courses tab, which is just about 3 tabs to your left on that gray bar, and we could put them there. So then not only can they view them, but they can also go back and review them. If they missed a meeting or whatever, they can go back and watch the recording. So that is just a really high level of what this website is able to do. Under that Whitebart Courses, we hope that very soon you'll start seeing some things with the IRHA, and Whitebart Corporation is actually creating our own courses and offering out there to our partners and to our members. So I think that's it, unless anyone has any questions, which I don't think I can see those questions anyway. But we can come back to that if you have questions. And then I think I just have one more slide. And so now we are to strategic planning, and that's kind of where we are right now. So in January 2018, we're going to start to gather and have our Year 3 Strategic Planning Committee meeting. And this will begin with a video conference, and later in January, we're going to have a half-day meeting and kind of just come to the table and have a brainstorming session to review and analyze the threats and identify marketing opportunities to further our sustainability post-grant funding, which we all know is coming very quickly to a sunset. So that committee is going to have IRHA staff, some of our network directors, some grant partners, and the executive director of the IRHA, Don Kelso, who you heard speak in that video. Our agenda is to really formalize that strategic plan I talked about earlier, and then finalize our sustainability and discuss and identify our next steps.
Can you hear me?
Yes.
Hi, can you hear me?
Taylor has a question. Stephanie, do you want to unmute your phone line?
Forever to figure out how to unmute myself. Oh my gosh, this is awesome. I work with an AHEC. And I'm just curious, I didn't see the AHEC logo on that one page with all of that, and that's a lot of what we do is connecting rural communities with future providers. Yes, I can. That's probably another topic. But I'm curious on your dashboard with all the courses that you're offering. Did you guys write every single course, or are you using other curriculum kind of? Yeah. So I was like, how do you, for instance, I saw HIPAA overview. Obviously, let's just say we use some, resource out there. How do you do that and then charge? Like, how does that work?
No. No, that's good question. So when we first started this, continuing education was not even on our radar. And that's why I said when this project kind of started taking on different lives and different paths and we saw different needs, that's when we started saying, you know, we really need to help to provide more continuing education to our, you know, our COGs and our RHCs and the people working in them. And the whole idea of becoming a continuing education provider, like I know many AHECs are, is not off the table, but it was just more than we could handle at that point. So when we were looking for LMSs, when we landed on, we were introduced to a guy named Ron at the NRHA conference at Relias, and he works for Relias, and those courses that you saw are actually created by them and their subject matter experts. And so we are offering a platform and helping to deliver those out to the rural healthcare facilities. And instead of a hospital having to come along and, you know, and purchase that and do branding and have they can just go through ours. Now, we do plan on doing some continuing education of our own. Right now, we've got some opioid, we have an opioid consortium here in Indiana, and we're going to have some training that's being hosted on there. The courses that we are creating for continuing education or just for informative sessions
I think
or
so. So probably you're paying some sort of subscription or something on your end to have access to those, and
the
then you
things you
just
see
turn
for
around
continuing
and charge
education and
participants a
CMEs,
little
those are
something to have
actually
access
created
to
by
them. Okay, that
Reliance
makes sense.
in partnership with us. So does that answer your question? Okay. Yes.
Okay.
Well, no, we're actually not. Yeah, no, we're not charging for it specifically. Those are their prices, so there's no markup. So it's not,
Okay,
you know,
so
it's $15, and then we decide it's going to be $20. That is just theirs. So we are basically just kind of like the middleman in that, and helping our facilities to connect to this other opportunity for them to achieve continuing education credit, with the idea that one day we want to. One day in the very near future, we want to also offer continuing education of our own created, because at the IRHA there's almost 20 of us on board, and everyone is a subject matter expert in something different, and it's great because we make a great team.
And then can I ask
and there's
another
so much knowledge that
and you probably
several
covered
of
this.
us have experience in
so
creating
many good things, and I
continuing
was writing it down
education
and
programs.
actually cut pasting your
So
screen
that's something that is
shots
going to be,
on a
when we
Word
start doing that
document.
strategic planning in January, that's one of the things that we're really going to hone in on and talk about and brainstorm.
But when you created that community college course, I love how you said, because in the AHEC world, we're kind of having to gear up this whole AHEC Scholars program, and it's a lot of extra work. And I love how you said, hey, my first year I could do electives, but when I got into the meat of my training, it wasn't an option. How did you get the community college? Like, where did you start with a community college to get them to buy into it being or create a credit course for you, or how did you do that?
Yeah.
Okay, and I can.
Cindy, can you unmute yourself and jump in right here? Cindy Large she's been on this project from day one. I actually just joined in March of 2017. And so I know the answer to that, but I might stumble around a lot. So if Cindy's still on, if she could just start too and just kind of give you like a real brief explanation of how that happened, that would probably be the best. And maybe she's not. Okay, yeah, we can do that. I real high level because maybe she's not on the call anymore.
Wow.
Yes, we went through them, and they kind of pushed it through their curriculum really quickly, for lack of a better explanation. And we had to go through the provost and all of that and get it approved. but they actually did that. They actually got it approved for 3 college credits. When we're talking about this other university we're working with, in the summer and fall, it's going to be offered as what's called a special topics course, where you don't really have to have it pass through Curriculog. We can just kind of offer it out there. And in the meantime, we'll be going through all of the process of getting it actually approved for 3 college credit hours. So, and one of the ideas we have, and we've been approached, and so, like I said, in strategic planning January, we're going to start talking about this too, is offering this at a high school level and kind of giving high school students that leg up. So not only are they getting college credit, but they're also being introduced to rural far before most students are ever introduced to it. And so that's definitely on our radar as well. Like
Does anyone else have any questions? Oh, go ahead.
Heather, this is Cindy. I'm sorry. I was just listening to my computer speaker, so I had to call in.
Oh, sorry.
So real quickly, just to answer a question, it took about a year of us working with our community college. There are a lot of steps that they had to go through in order to get this approved. We have not run into as many barriers working with the four-year university. They've been able to just do approvals through their department heads. And
okay, so it sounds like it was university. Just a little bit easier working with the university than the community college.
Originally, there were a lot of meetings. It probably took us about 6 months to get approved for a 3.0
and then does that transfer? Does that transfer pretty easy?
So, and they were included as a partner in our grant funding.
Sorry, go ahead. Well, like a lot of people will take 3 hours here at UMKC knowing that they're going to finish a degree at MCC or something like that. So once it's approved at one, at the community college level or the four-year level within your state, does it seem to
You mean the actual course, like the curriculum, or
like
getting it approved from one college to the
only
next?
those schools that you've gotten it approved at? Okay. That's probably true.
I think that would depend on any articulation agreements that are standing between the colleges. That's my educated guess.
Thanks, Stephanie. Does anyone else have any questions? You can type them in the chat box or press *2 to unmute. Looks like Kristen from Union County Network in New Mexico is typing. There she goes. Okay, she was just typing a comment.
I was going to say, yeah, we're meeting with Kristen on Thursday actually to talk about this a little more in depth. So thanks, Kristen.
That's awesome. Well, we're getting close to the end of our time, so I want to honor everyone's time and being able to wrap up. So thank you so much, Heather, for sharing this level of background and detail about the Rural Health course and the White Bark Academy. Both very interesting, exciting that they're so successful thus far. It was interesting to note the challenges and obstacles that you had along the way and how you overcame them. So we really appreciate your sharing all of that with us.
Thank you very much.
Yeah. In regard to the PowerPoint, the recording and the PowerPoint will be on the RHI website. And we will send out a link as soon as we get that uploaded to the site so you can all have access to that. In the meanwhile, it looks like you all are participating in the poll questions. I appreciate that. I want to quickly go over some upcoming events. Excuse me. So January 17th will be our next webinar, and that will be around employee satisfaction survey implementation process. And then in January, we will have our next round of TA check-in calls. February 14th is our next peer group call. And then February 27th is the all-program meeting in Rockville, Maryland. And we touched on this before the call got started, but for those of you who joined us after I made, we spoke about this, Marcia wanted me to remind everyone that she would like to see you all at the all-program meeting in Rockville, and that if you have not yet registered, to please do so as soon as possible. If anyone hasn't registered and needs the registration link, you can reach out to Marcia or I directly, and we can get that to you. Do we have any other final thoughts, comments, questions? All right, hearing none, I would like to, again, thank you so much, Heather, for presenting for us today. And I know that you've said before that you're very happy to have some offline conversations with folks. So please feel free to reach out to Heather as well with any additional questions that come to mind. Thank you all for dialing in. And if I do not talk to you, we at RHI wish you all a very Merry Christmas.